I'm Isabella Babinska. I'm a grant writer with McLaren Northern Michigan Foundation, and I'm here this morning with Jeannie Melton, Oncology Nurse Navigator, to talk about her role at Carmano's Cancer Institute. Jeannie, can you please tell me about your role as a nurse navigator?
Sure. I follow all of our lung cancer patients from the time of an abnormal scan through diagnostic imaging and into treatment.
Great. What does an average day look like for you?
Oh my. I start off my day looking at abnormal scans, reviewing those along with pathology and our lung cancer screening. I coordinate our lung screening program and in addition our multidisciplinary tumor board. I accompany patients when I can to all of their consults with pulmonary, cardiothoracic surgery, medical oncology, and radiation oncology. In addition, I provide education and support for our patients.
That's a lot. Thank you. So how frequently do you work with patients with a brand new diagnosis?
All the time. At any given day, there's probably a dozen cases being worked up through the whole continuum of abnormal scan into treatment.
Okay. And what role do donors to the McLaren Northern Michigan Foundation play in your program?
Well, our navigation program wouldn't even exist if it wasn't for donors. They were able to see the vision, as we were, to have someone be an advocate for our patients and that go-to person to see them through the process, to ease some of their anxiety, to provide education and support along the whole continuum.
Hi, this is Isabella, back with Jeannie Melton, Oncology Nurse Navigator, to talk about the smoking cessation program. Jeannie, can you please tell me about the smoking cessation program?
Sure. We offer a smoking cessation program through the American Lung Association, and it's called Freedom from Smoking. And it's a 7-week course, and we teach patients what they need to do to quit smoking.
And is that the goal of the program?
The goal of the program is to provide patients with tools necessary to quit tobacco by allowing them to discover why they smoke and develop a personal plan to quit.
So I see you have these lung models with you. Can you tell me about these, please?
I can. This is a normal healthy lung, and it's smooth and it's soft and it's pliable, and it's a non-smoker's lung. Then we have this one. This one is full of tar, it's scarred, there's air pockets, and there's tumors. The one thing to remember is that once you've smoked, we can improve the function of the lung somewhat, but some of these things will not go away.
And can you please tell me a success story of the smoking cessation program?
I can. I think that we really consider it a success if people are able to identify the reasons why they smoke and develop a plan to quit, whether they actually cut back or quit. But we did have a patient that was really struggling with her addiction, and she was to have a stem cell transplant.
Wow.
And she needed to quit smoking. And so through the Prevent Cancer Foundation, we were able to provide her with a Freedom from Smoking online class, and she was able to quit. And she is so excited about her future and her ability to have further treatment for her disease.
That's incredible.
Yes.
Thank you. Hi, Isabella here again with Jeannie Melton, Oncology Nurse Navigator. In addition to treating patients' physical symptoms, Jeannie also provides emotional, psychosocial, and financial support for patients. Jeannie, can you please tell me about that aspect of your job?
Yes. When a patient has an abnormal scan and they know they need additional testing, they become anxious. And with providing education and support, we can help them through that process. In addition, patients are scared and they just really need to know what to expect, and that helps them through the process.
Absolutely. And why is this important for you to provide this type of assistance for patients?
Well, patients are more than a diagnosis. They have family and they have needs. They have physical emotional, family, financial, transportation, insurance, all of these needs and these barriers to care make it difficult for patients. And to have someone connect them with resources and provide education to get them through.
Through that treatment.
Yes.
Yeah, that's amazing.
Yes.
Is there a patient story that you can share with us?
Well, recently we had a patient who had no insurance. She had an abnormal scan, was found incidentally, and she needed to have some additional diagnostic imaging, and she was very concerned about the cost. So we were able to connect her with resources to get insurance and get some assistance. And she was able then to proceed through the whole continuum of care into treatment without having that weighing on her. Being able to connect patients with resources, whether it be insurance or it's nutritional, financial, it's really important that we can do that. We have local foundation and we have national foundations that we can connect patients with, and it really does help them through the process as we deal with all of these other barriers to care.
Absolutely. So thank you for your support of our Oncology Nurse Navigator program and making this available to our patients. Welcome back. We're here with Jeannie Melton, Oncology Nurse Navigator, and today we're talking about early lung cancer screenings. Jeannie, can you please tell me about these early lung cancer screenings?
I can. Lung cancer screening is available to patients 55 to 77. They have to have had a 30-pack-year history of smoking. If they've quit, they have to have quit within the last 15 years. And they have to be asymptomatic, free of any kind of symptoms. In addition, they need to sit down with their provider and they need to go over the risks and benefits of having screening and determine if they qualify.
Very good. So the goal is to identify lung cancer while it's still treatable. Is that correct?
Absolutely. Lung cancers they're typically found when a patient's symptomatic, and then the disease can be already advanced by then. So if we can find lung cancers when they're small and treatable with curative treatments, we have really done our job.
That's amazing. So what if the screen finds something?
Well, if we find something on the screening, it could be a small nodule. We find those often. Those can be followed with regular screenings annually. We can follow those in our lung nodule clinic that helps our providers just to follow those nodules. In addition, we can find something that is suspicious. Now, that doesn't mean it's going to be cancer. It could just be, it could be something else, but we need to follow through with the diagnostic imaging that's recommended by our radiologist and determine what's going on in that lung.
Very good. And are there any success stories you've had through this process?
We have. We had a gentleman that was able to get a screening by the recommendation of his provider when he was 55 years old. He met all of the criteria and had just met the age requirement. He had the screening done and we did find a lung cancer. We were able to help this gentleman get his treatment. He had surgery and it was a stage 1 lung cancer. We were able to help him with many of those other psychosocial issues that we talked about earlier. But he has become an advocate for lung cancer screening and tells everybody he knows that they need to be screened. Well, we can help him through the Prevent Cancer Foundation. We've had a grant that has helped us with this lung screening and provide education to our communities and to our providers and get the word out so that patients can be screened and we can find lung cancer early while it's treatable and curable.
That's amazing.
Yes.
Thank you.